Hi guys, it's Tamara. I am back with another video today. It is Wednesday, and we're going to continue our conversation on the topic of multiple personality disorder. For those of you who have been subscribed to my channel, thank you so much for coming back. And for those of you who are new and not subscribed, I encourage you to hit the subscribe button over here. Then that way you can stick around for all the videos and all the topics that we're going to be talking about this year. We've been actually talking a lot about personality disorders lately, counseling, treatment, that kind of thing. And so all this week I decided to dedicate every single day to the topic of multiple personality disorder. One of the reasons why is because I have an email box full of emails asking questions about loved ones, friends, family, about whether or not this person is possessed or has multiple personalities. So I figured dedicating an entire week to this topic may be helpful. The benefits for you today in this video is that you can learn to differentiate some disorders from multiple personality or dissociative identity disorder. So let's go ahead and jump in, all right? So what's confusing about dissociative identity disorder, which is the more sophisticated and clinically approved term, not multiple personalities, but dissociative identity disorder. What is complex about it is it can sometimes be a co-occurring disorder with something else, right? So you could have dissociative identity disorder and borderline personality, or you can have dissociative identity disorder and depression, right? So it often co-occurs with something else, or the symptoms are so similar and on a thin line that it can be very difficult for providers and family to not disassociate, but differentiate between two different disorders, all right? So I'm just gonna go down 4 common diagnoses that often confuse the picture of dissociative identity. The number one thing that families that come to me have struggled with is borderline personality. When I meet with a family who has an adolescent or a young adult who is struggling with, impulse control and suicidal thoughts and behaviors, self-injurious behaviors, when I have a family who's dealing with somebody who has roller coaster emotions and flip-floppy kind of perception of other people, right? They're never one way. They're always switchable in how they see things and how they feel things and what they say and do. The individual says or asks me the question, is my child or loved one possessed? Or sometimes they'll say things like, is my child or loved one split personality? So let me clarify that. Borderline personality disorder is not a split personality. Borderline personality disorder is basically emotional and psychological chaos that causes the individual to fear abandonment, self-harm, want to end the emotional pain through suicide. It also includes an individual who's very moody and switchable and sometimes emotionally erratic or histrionic. The individual also may struggle with self-identity, right? And fearing that they're going to be abandoned because I'm not good enough, I'm not smart enough, I'm not pretty enough. Borderline personality disorder is a long-standing, chronic, or pervasive disorder. Again, you cannot medicate a personality. I'm going to post a video up here that talks about the neuroscience of personality disorder, so you'll understand what I mean by that. But you cannot medicate a personality disorder. You can hardly counsel it, to be honest. There are some research studies that suggest borderline personality disorder can be treated with counseling and medication. That's a whole other video. But that is not split personality, right? An individual who's moody and flip-floppy and irrational and impulsive and has really flip-floppy relationships, that is not split personality. It can seem like it because they are different people from time to time. But dissociative identity disorder basically involves the splitting off of one's main character, splitting off of that main character into multiple pieces, right? So think of it this way. A broken or shattered piece of glass is going to go everywhere, and there may be a bigger piece of glass that outshines all the little pieces. That is multiple personality disorder. You have one main character who is fragmented and split off from that main piece or character, right? So borderline personality disorder has nothing to do with multiple personality disorder. They are two different diagnoses, and they often have different symptoms and a different course throughout a person's lifetime, right? The next thing that people get confused about is schizophrenia, right? Schizophrenia is a psychotic disorder that can be treated with medication. It is not a personality disorder. It is a mental illness that is characterized by hallucinations, so seeing and hearing things that other people can't see or hear, feeling things crawling on the body when that's not really happening, delusions, so having this firm conviction or belief that the FBI is after you, that you're being harassed through your vents, that you are being watched by cameras that are little and can be as small as dust, right? So that's a delusion. There's hallucinations, right? Hearing and seeing things that are not there. The course of schizophrenia is also different as well. The individual can be very disorganized in their thoughts and their behavior, right? They seem to be very much controlled by their perception of life, which is often skewed, right? They can have very bizarre delusions, right? That there's small cameras as little as dust that's watching them, or they could have very realistic delusions like, I work for the FBI and I feel the FBI is harassing me. You know, could be. So it's non-bizarre, but the illness tends to take over the person's life, and it interferes with functionality in a lot of ways, right? It's a psychotic disorder. The next thing that often gets confused with multiple personality disorder or DID is sociopathy, right? A sociopath. So let me clarify this. Dissociative identity disorder does not include an individual who is not empathetic. The individual may be very loving, very caring, very empathetic. They may be very self-aware. They just struggle with fragmented pieces of their personality that sometimes can result in different facial expressions, hair color, clothing preferences, gender identification, right? It can be different interests and different likes and dislikes. Somebody who's a sociopath often has narcissistic tendencies. They have no empathy, right? And I'm going to post that video up here because I talked a lot about sociopaths versus psychopaths. And that might help you gain an understanding of this as well. Sociopaths, I want you to keep in mind, have no empathy, have no ability to sympathize, right? They are very narcissistic and very uncaring. That is not a person who has dissociative identity disorder. All right. The fourth and final thing that a lot of people get confused with is delusional disorder, because somebody with dissociative identity disorder can come across as delusional, right? Especially if they change their name, change their personality, change how they look, right? If they're walking around saying that they're Sasha instead of Tiffany, then it's possible that they could be delusional, but it's also possible that they have a switch in personality as well. Delusional disorder basically is characterized by a strong conviction, right? A strong belief of something that's not true. Somebody with a multiple personality disorder or DID doesn't have a strong conviction or a strong belief that something's true, but they really and honestly begin to exhibit different pieces of who they are, right? That's multiple personality or dissociation. Let's talk about demon possession. So if you go to Christianity, Catholicism, if you go to Baptists, if you go to Pentecostals, you're going to find the belief that if medication doesn't work, if therapy doesn't work, if long-term coaching, life coaching doesn't work, if substance abuse treatment doesn't work, and the individual continues to struggle in their lives, you might get a priest that starts saying, I think this individual is possessed. We have heard changing in vocal tones. We have experienced spiritual phenomenon around this case or this individual. This individual strongly supports the idea that they are possessed. This person is a target because of this, that, the other, right? So I'm going to post some information in the description box below to give you some ideas. I'm also going to post a video that was based on a true story from a young lady in Germany who struggled with all of the symptoms I'm talking about in this video, and yet nothing could help her, and the priest believed that she was possessed. Now, if medication and typical forms of therapy is not working, then demon possession may be the next thing. Everybody has a different perspective of of life. Everybody has a different belief system. If an individual is not getting treatment from medicine and mental health care and life coaching, they might be at their wits' end to where they recognize that maybe something spiritual is going on with me. Maybe I need to pursue a theologist, a Catholic priest, a Baptist pastor, a Pentecostal pastor, somebody that can help me understand this. There are scriptures that focus on demon possession as being very similar to mental health conditions. So there are some people in different cultures, and we're going to talk about that in tomorrow's video. There are some people in different cultures who believe that they are possessed. There's actually a disorder in South Africa that is labeled as possession or spiritual and bodily possession. And so we're going to talk about that in tomorrow's video, because I think gaining awareness of that and being sensitive to how other people view this disorder, dissociative identity disorder, is going to be important. Not everyone believes it's a diagnostic category that needs medication and therapy. Some people believe that it's a spiritual situation that should involve demonology or a theologian looking at an exorcism. So we're going to talk about that a little bit more in tomorrow's video, so stay tuned. Thank you so much, guys, for being with me today in this video. I encourage you to give it a thumbs up if it was helpful or interesting to you. I also encourage you to hit the subscribe button so that you can stick around for further videos. If you have questions and comments, I encourage you to post them in the comment section below. Let me know what you're thinking about this topic, and let me know what you think about exorcisms and the belief of demon possession. What do you think about that? I'll see you soon. Bye-bye.